All right, so we are looking at day 7. This is our final PowerPoint here. We are looking at cancer and chronic lung disease. So cancer, when we're talking about this, it's not that common that you're going to work with cancer patients who are currently struggling. A lot of times you'll be with clients who are in some version of remission. Although, don't get me wrong, like definitely they're out there, but a lot of times like cancer patients, will often have like physical therapy covered by their insurance. So they won't necessarily be in a gym setting that often. But some of them super motivated. I've definitely had like cancer clients before who super motivated folks who are just like, you know what, I'm doing my physical therapy and I'm working out because I'm a boss. And I'm like, that's awesome. So it can definitely happen. So that is going to have a lot of different effects on the body. Let's go ahead and talk about them. So cancer is going to be defined as any of the various types of malignant neoplasms that invade surrounding tissues and metastasize to several different sites. So what we mean by that, when we look at like what a, and I was talking about this morning, but I never got to look it up. When we talk about like what a free radical versus a, oh my God, antioxidant. We talk about like what free radicals are, right? What these are is they are basically these chemicals or just like materials like atoms that have unpaired electrons. Okay, so what actually happens with antioxidants, these are some crappy cartoonish drawings. I'm looking for a good one. Body tissue. What ends up happening is they're known as like reactive molecules, right? So that's what a free radical is. They like to react with their surrounding environment. Man, this is nuts. Let's see here. Vitamin C protecting body tissue. I can't believe I can't find a good picture of this. Well, okay. So when we're talking about like what free radicals are, they, like I said, they are reactive chemicals. They are missing electrons, right? And so when we see it, what's happening, we have this unpaired electron over here. These two actually are paired in this picture, but imagine like this one isn't, right? Actually, we'll see it right here. There's an unpaired electron. And so what that unpaired electron wants to do is it wants to fill its outer shell. And so it's looking for an electron somewhere. And if you have this in your body, let's say you're a smoker or, you know, let's say you just eat something super unhealthy, right? What's going to happen, actually, this is great, is an electron is going to get stripped away from some other area. And if that area is your body, well, now you're going to have a cell that has an atom in it that lost one of its electrons. And now that cell's integrity has been compromised, and so it's modified slightly, and now that cell can't function the way that it's supposed to. Okay, now if that thing that gets structured is your DNA, which is located in the nucleus of every one of your cells, right? If your DNA gets modified, well, your DNA is the blueprint for how to make new versions of you. So if you modify your DNA, what ends up happening is you have like an imperfect copy of a cell that gets made. And then that imperfect cell makes another imperfect cell, which makes another imperfect cell, and it starts to grow. And that can eventually metastasize and prevent your tissues from working the way they are supposed to. And that is how free radicals sort of create cancer inside the human body, right? That's what we describe when we're talking about like a tumor. And so what an antioxidant is, right? This is, let's say this is vitamin E or vitamin C or vitamin K or whatever, right? This is an antioxidant right here. What it does, this actually has a whole bunch of extra unpaired electrons surrounding its outer shell. And therefore it's really willing to donate those unpaired electrons to that free radical. And so now that free radical is happy because it didn't have to like, you know, it got its outer shell filled, but it didn't steal it from your tissues. And that's why it's really important for us to eat fruits and vegetables that are high in vitamins A, vitamin C, vitamin E, vitamin K, and then the more color is in your foods, particularly what we call phytochemicals. Like if I just look up phytochemicals, you're just gonna see a whole bunch of pictures of like brightly colored fruits and vegetables, right? So turmeric is a really good example. Grapes, green tea has tons of antioxidants in it. That's what EGCG is, if you've ever heard of that. Um, uh, all the stuff that gives fruits and vegetables their color, those are phytochemicals. And that's why it's so important to have a diet that is high in fruits and vegetables, because those protect you from different types of cancers. And that's the thing about cancer, is there are just a lot of different types out there. And that's why we haven't really been able to find a cure for this, is because all of these are acting very different ways. So it is a group of non-functional, aggressive cells that eventually keep your tissues from working. And it is the second leading cause of death in the US. We see a 44% probability of getting cancer at some point in your life if you're male, and a 38% probability if you are female. Now, granted, those numbers seem really high because they are. A lot of those types of cancers are things like skin cancers, which for the most part can be lanced off. It's not like 44% of people die from cancer, but they'll get it at some point in their life. And this is where the freaking PowerPoint died today. But speaking of, like, skin cancer, right? So if you've ever gotten like a sunburn, what that is actually, there's so much UV ray radiation that it has damaged the cells in your skin, and it has modified their DNA. And your cells actually have, they're actually programmed to know when they've been compromised. Like, your cells know, your immune system knows, like, the cell's like, oh no, I've been compromised, I don't function the way I'm supposed to. And they'll actually do this really cool process called apoptosis, where they will essentially self-destruct. And that is why you start peeling when you have a sunburn. They turn bright red because they are literally committing suicide in order to prevent you from getting like cancer. So, that time that you stayed out in the sun too long and forgot your sunscreen, your poor cells, they're the ones who, paid the price. So that's actually what that's what a sunburn is. So, when we see patients who are in cancer remission, treatment for cancer is brutal on the body. It's essentially poison, because you are trying to kill these really malignant cells. And so because of that, excessive fatigue is going to be one of the most prevalent symptoms that we see in cancer patients. They are going to feel weak. They are going to feel fatigued. They will often experience a lot of nausea. They will often experience a lot of shortness of breath. All of those are really common. And because they are not moving as much, and because they are taking these chemicals that are destroying cells in their body, they will see a decrease in lean muscle mass, which is also going to further lead to sort of lethargic movements. Then they are also it's going to be killing a lot of their immune system. So then they are also going to have a decreased immune function. So it actually becomes really important when you're working with cancer patients to make sure you're always wiping down their machines before they get on them, and try to keep it as germ-free as possible, so that they don't, catch like a common cold while they're in the gym. So all of those are considerations that we kind of want to keep in on back of our heads whenever we're working with a cancer patient. But exercise does some really amazing things. It actually helps them retain their lean muscle mass, which obviously makes sense, but is a huge deal when it comes to clients who are struggling with this. It improves their aerobic and their aerobic metabolisms, which are great, because that is going to have really positive effects. That's actually been shown to even reduce their risk for like further developing other types of cancers, which is really nice. It has a really positive effect on their mood and their self-esteem. Obviously, struggling with a disease like this is incredibly challenging, and so it can have really negative effects on how people feel. So exercise producing a lot of healthy endorphins, which leads to like positive feelings. And it also just, let me tell you, the one thing I've heard when it comes to like positive mood and self-esteem, when I've worked with cancer patients, their favorite part about it is not the fact that they're like, lifting weights and overcoming things, which I think is great. It's just that it gives them something to look forward to and something that they have control over in their lives. And that is huge. Like you'll get people who will say, "Hey, I just want to say thank you for, being my trainer. This has really given me like a sense of ownership in my own life, because when you have a disease like this, it a lot of times feels like you are just out of control. You have no control in your life, and like that's the worst feeling in the world. That's why I, get super frustrated when my internet doesn't work. I don't like no human likes not being in control. So it has really positive effects on things. And so we also will see, obviously, like less fatigue with improved aerobic capacity. Every activity of normal everyday life is improved. So when we are prescribing exercise, right, it's really important to try to develop their strength and endurance. We want to spend a lot of time working not only on the aerobic side of things, but also on the strength side of things. If our client is in remission, our goal is not necessarily to make them the world's greatest athlete. It is to get them back to their fitness levels pre-cancer diagnosis. So we are going to work a lot on balance, bone remodeling. We're going to work on bone density, so weight-bearing exercise again. And we want to try to reduce muscle weakness by developing their strength. Static and active stretching are both recommended. Foam rolling can be okay if there are no complications. If they are currently going through, if they are on like a cancer medication, a lot of times, guys, that will cause really easy bruising. And man, like you just do not want to be the trainer. Whoops. You do not want to be the trainer that causes this to happen. SMR bruising. Really? Not finding a picture, huh? Foam rolling bruising. Yeah, you do not want to be the trainer that causes this to happen to your client. Is also why they say don't foam roll your IT band. So you do got to be a little cautious with that sometimes. If they're on like a medication that causes really easy bruising, be careful with the foam rolling. It can be okay. It really can be, but just make sure it's not causing any problems. Cardiorespiratory training, start with stage 1, but if your client can handle it, you can take them all the way up to stage 3, if they can handle it. But a lot of times, if they're currently on some type of medication, their cardio is going to be wrecked. So we're going to see that lower. And that's just, there's a note that I put in there. You're going to notice down here, it doesn't really say that. And then core and balance training are both huge. We're trying to get this person up and walking again, right? So treadmill walking, stationary cycling, low pin, all the normal stuff, low impact aerobics, 3 to 5 days per week in case they need recovery. 50 to 70% of their heart rate reserve. So we are taking into account their resting heart rate again, because they don't necessarily have like a heart dysfunction with this disease, but they could have decreased cardiovascular. So they might have a hard time breathing. So make sure you're taking that into account in case their cardio is destroyed. You may have to start with only 15 minutes of activity and they might be completely wiped out. I mean, you guys have experienced that when you have just like a hard day and you've been working out like crazy and you're just like wiped out after you're done. Sometimes cancer patients will deal with that in 10, 15 minutes. Because that's really what that medication does. I mean, it just completely wipes. It's not the disease, it's the medicine for the disease actually is what kind of takes you out. So a lot of times 15 to 30 minute sessions are plenty. Pushing, pulling, overhead squat, single leg balance if they can handle it, foam rolling if they can handle it. And you'll notice we are going to probably be in a relatively high repetition range because again, we are trying to develop their endurance. So we actually really like high repetitions. Avoid heavy lifting in the initial stages of training, which, we do that with every client. But we may need to start with simply 5 minutes of exercise and work our way from there. Man, I had this client who just, it was so sad. She kept like, she had breast cancer and then she went into remission. Then she got it again and she went into remission. I knew her for 3 years and she had 3 different diagnoses. And she was tough, she'd be there literally every day. She would do group exercise classes a lot. And she was great. She would always like take little breaks here and there when she needed them. And then she would get right back on her feet. But you could definitely tell when she was on heavier doses of medicine because, when she was in remission, she was like the Energizer Bunny, toughest lady I've ever known. But when she was on her medication, she would get winded from doing the same thing she had done 6 weeks prior. But she would get winded in 5 minutes, So that medicine is absolutely brutal. Any questions on cancer patients, guys? No new questions? All right. So, all right, chronic lung disease. So obviously this can kind of feed into different types of cancers, especially if you have a client who is, has COPD or something. But chronic lung disease, they all kind of act the same, but this is going to fall into 2 major categories here. It is any and all conditions that decrease an individual's ability to bring in oxygen. So there are 2 main versions here. There's what is called a restrictive lung disease, which is fairly rare, but this is a condition of fibrous lung tissue that results in the decreased ability to expand your lungs. And so one of the versions of this is what is known as cystic fibrosis. Fairly rare, but what this is actually is where your airways will get cysts on them, which decrease your lungs' ability to expand. So you'll see sometimes restrictive lung disease. Nice. Restrictive lung disease is where people will get certain types of scar tissue. Maybe sometimes it's even some type of trauma where they've experienced sometimes football players will actually get this. So if they ever get a broken rib during a game, it can sometimes collapse parts of their lung. So that can be it. I had a fellow student who was on the baseball team in my college, and he got hit for rounding second or something. He was sliding, and the other guy just impacted him. Totally collapsed his lung. Yeah, when that happened, he was, that he had restrictive lung disease on that side forever, kind of ruined his career. But that's what restrictive lung disease is, right? It's the inability to expand your lung. We will also sometimes see obstructive lung disease, and this is an altered airflow in the lung. So this is definitely the most common type of lung disease we will see. One of the most common versions of this is referred to as COPD, or chronic obstructive pulmonary disorder. So you are chronically obstructing your lungs, right? And so when you look at COPD, you will notice you will have sometimes things like excessive inflammation of the little bronchioles in your lungs. That means that, it's almost like hypertension of the lungs in a way, right? There's literally just not enough air that can move through this empty tube because of maybe inflammation, or maybe it's because there are simply materials blocking it. A lot of times you'll see mucus covering your bronchioles themselves. That's why, I know it's gross, and I know we've all seen it. Healthy lung versus. We've all seen, the commercials where they're like, "This is your lung on cigarettes," right? And we have definitely seen that. But what that really means, right? What that really means is there's basically crap covering all those little bronchioles. There's just this stuff called tar, right? And this is why, and I know this is a somewhat contentious opinion, especially in 2020, this is why I'm still not a huge fan of smoking anything. I don't think that vaping is good for you. I don't think that smoking pot is good for you. Now, that being said, trust me, I am fully aware of all the really super, super, super positive effects that THC and CBD and all those things, very, very positive effects that has on the body. Human body has these really great cannabinoid receptors. It does some amazing stuff. But putting crap in your lungs is never good for you. So I don't know, eat it. Take it through your digestive system. That stuff kills everything. Your lung system is really, I don't recommend smoking broccoli either. It's just not a very good idea to bring stuff into your lungs. It is a wet, sticky environment that is not designed to diffuse nutrients except for oxygen. That is literally it, oxygen and CO2. Other stuff is just too large to get in there. So then it just stays in there forever. And then you're stuck with tar. So there's my, we can talk more about that later. So asthma, emphysema, chronic bronchitis, all of those are examples of COPD. Even the coronavirus, like which, you know, everybody's dealing with now. When you look at it, coronavirus, okay, come on, lung. When you look at it, it creates scar tissue in the lungs. It is actually like the reason this disease is so dangerous is because like it basically does a lot of like fluid buildup, and then the way it interacts with your immune system is it creates scar tissue, and that's why we're seeing like we don't really know what the long-term effects of this disease are, but it's why people are taking it so seriously. Yeah, we're all pretty young in this call. You know, if we catch this coronavirus thing, we'll probably be okay, but who knows what the long-term effects are. It could result in scar tissue, which could give you restrictive lung disease, you know? So any questions on what we're talking about when I say chronic lung disease? I know this is kind of a broad category, by the way. You know, like those are two very different things, restrictive and obstructive. But the way we modify exercise and the positive effects exercise has are pretty much the same. But do you guys have any questions on that? Are you guys worried about any of that? Cool. All right. So what are our considerations to make? Well, frequently things that are associated with restrictive lung disease, oftentimes people will become very sedentary because it just becomes hard for them to breathe. You know, it's like, man, going upstairs sucks. I'm going to take the elevator. Man, parking far away from this door sucks. I'm going to park as close as possible and get a handicap sticker. You know, so what that ends up referring to is, you know, a reduction in overall activity, which we know is one of the most dangerous things you can freaking do in your life. The other thing that we know when it comes to exercise is you got to be a little cautious with your upper body activity. So upper body exercises that put your client into a weird posture can often result in what is called dyspnea, which is just a big fancy way of saying shortness of breath. So if you're doing like a high plank, for instance, right, you're putting yourself in a position like this, that may make it hard to expand your breath, your rib cage. So your client may have a hard time breathing. So they will often experience shortness of breath when you are doing upper body exercises. Swimming is a nightmare for somebody with obstructive lung disorders. So a lot of times they may be on supplemental oxygen, although not always, and they may experience muscle wasting and low body weight due to what is called sarcopenia. So because they can't get enough oxygen in, they can't supply their muscles with enough energy, their muscles don't get used, their muscles go away, right? So when we see like sarcopenia, let's see if I can find a picture of this, you will often notice it. You'll see a lot of times that sunken chest posture. You'll see like that kind of muscle wasting situations here. That is very, very common in people who have lung disorders. You will also sometimes see what will look like hypertrophy, but is not actually hypertrophy, where you'll see someone who is barrel chested. Sometimes you'll see people develop a body that looks like this, where it's like, well, that's a pretty muscular person. Not necessarily. This is often a symptom of COPD. And what that is that somebody who is breathing with their chest. And so they start to expand their rib cage rather than expanding their diaphragm. This person, even though their chest looks like there's a greater capacity, cannot breathe as well as this person down here. So that is definitely very common with COPD as well. Not awesome. What are some of the negative effects that this has? Again, kind of going right back to what we were already talking about. It's going to decrease your ability to exchange nutrients, particularly the oxygen and carbon dioxide. So because there is mucus or other materials, tar or whatever, blocking the bronchioles, then the blood vessels cannot exchange those nutrients because they're not able to get through that material. So when you see it, you'll sometimes see this. Bronchial blocked. Sometimes you'll see bronchioles which will get this material inside them, where they'll get like this mucus and things like that. And then that will often result, you can kind of see it there, that will often result in alveoli dysfunctional. Let's see if that pulls up what I want. Sometimes you'll see those alveolar sacs, little popcorn sacs. You'll see almost like osteoporosis. They'll actually puncture and the walls will sort of form together. Chronic bronchitis. Actually, oh, there we go. That's perfect. So, oh, actually, not quite what I'm looking for. Come on, help me up the right picture. Let's try emphysema. There we go. All right, so see this, you know, because there are all these little walls in here, and there's several different little pockets, that's greater surface area. That means more oxygen is going to be able to diffuse because there's more surface area for more oxygen to get into the bloodstream. When you see your alveoli like this, you'll often see them get damaged because it becomes very difficult to breathe in. And so that will actually fracture the walls. And now there is less surface area, which means there's a decreased gas exchange ability, right? There's either a substance blocking it, like in the, like if there's mucus, but it can also just be because there isn't as much surface area. And unfortunately, that is really hard to come back from. We also see decreased ventilation due to alterations in posture. There just won't be as much air brought in. Low levels of exercise, obviously, and shortness of breath due to those shallow breathing patterns. And that's not great. But good news again, exercise has really positive effects. So we will see an improved functional capacity, especially in their tolerance for the uncomfortable nature of exercise. Obviously, exercise is pretty tough, you know, again, no pain, no gain. So your clients will actually like build up their tolerance for that shortness of breath. You know, a lot of times, like I've, you know, had clients who are like, oh, I've never been able to run a mile. And it's like, well, you know, a part of that is just tolerance. You build up like a tolerance for those little side stitches and eventually they go away. We will also see a decreased shortness of breath symptoms. And then psychologically and physiologically, there's going to be benefits. Your client will psychologically feel much more positive. They'll have an increased mood. And then my favorite one, they will increase their internal locus of control, which I freaking love. The belief that they are in control of their lives, not some external forces. So huge, huge, huge fan of the fact that we see positive benefits mentally associated with exercise. So our special considerations, this is kind of a fun one here because I think this is kind of weird, but peripheral heart action circuits are super recommended for clients who have breathing problems. Now that seems really weird because you're like, wait, the thing that we did because it was good for blood vessels, that's good for breathing? Yes, but not for the same reason. There's nothing magic about peripheral heart action in terms of their blood pressure when it comes to breathing, but by doing an upper body exercise and then giving that upper body exercise time to rest by going to the lower body exercise, you are going to decrease that shortness of breath sensation that they will often experience with upper body exercise. So peripheral heart action is very helpful because it just simply takes some of the pressure off the upper body and allows them to breathe. So they love that. So 3 to 5 days per week. Oh, my mama's calling. 3 to 5 days per week. Oh, I forgot. Elliptical trainers, treadmill, steppers, a lot of cardio stuff here. All of it's fine. 3 to 5 days per week, 40 to 60% peak work capacity. Now, this is another one, peak work capacity. This is another example of where you're going to put your client on a treadmill or on whatever piece of equipment it is, and then you are going to have them exercise until they tap out. This is a very unique situation. Very similar to coronary heart disease, right? We wanted to work at a percentage of their peak capacity. So you put them on a treadmill until they tap out. And then you work at a low percentage of that because you're trying to develop their endurance. You don't want them to have to tap out from exercise. So if they got up to a 7.0, on that treadmill, and that's where they were like, no, I can't do anymore, can't breathe, right? Great, let them recover, let them relax. Then you are going to work at 60% of 7.0. And that's going to allow them to work on their endurance without ever getting tapped out. But you need to find that upper threshold. So that's there's a very unique one compared to some of our other that we've seen. Duration, work up to 20 to 45 minutes if you can. Again, they're gonna have a really hard time going any longer than that. Assessment's totally normal. Just be cautious with the pushing and the pulling, because again, that could lead to shortness of breath. Flexibility, static, active, all that's fine. But when it comes to resistance training, a lot of times they are going to get exhausted when they do upper body exercise, and they're going to experience shortness of breath. So we'll oftentimes see one set of 8 to 15 repetitions. That is the lowest volume we see out of any population in this entire course. And that is just simply because they're going to have a really hard time breathing. So I like to do peripheral hard action circuits. I like to try to extend that beyond one set personally when I'm working with COPD clients. I definitely start with one set for the first few weeks and then eventually add one in with like a short rest period in between. So I will often do like an exercise A, then an exercise B, and then I will let them rest and then go back. So it's really kind of like that modified PHA that we did in our SOAP notes earlier. So again, we see our special considerations. Upper body exercises cause increased shortness of breath, so make sure you allow for sufficient rest in between sets. Any questions on that? Feel good about COPD?
Is asthma a type of COPD?
What's that?
Asthma a type of COPD?
Kind of. Asthma is a little different. Asthma, I'll pull up a picture here. Asthma. When you see it, it's actually an inflammation of the blood I almost said blood vessels. God, bronchioles. Whew, what happened? I just had a stroke. It's inflammation, and so it's really much more similar to restrictive lung disease than it is obstructive lung disease. So they're having a hard time like opening their blood, their airways. That's why they'll take an inhaler. What that is actually a steroid, which decreases inflammation. So asthma's close, but it's a little more like restrictive lung disease. But you can treat them the same. I mean, like when you're writing like an exercise program, totally the same thing. Okay, so let's take a look at our SOAP notes here. So here's our client, Tatiana. She had breast cancer, but she is in remission. She used to, I forgot. This was where I had my class build this. I remember the SOAP note. My class built this one last time. They were like, you've been making all these up. We want to do one. And I was like, all right, cool. Our client Tatiana was a pole dancer as a hobby, and she played tennis, but she was a rocket scientist. She had a generally sedentary job working at a computer 4 to 6 hours a day, but that was her favorite, favorite types of like fitness. Her goal was to increase her energy and get her upper body strength back so that she could do all those really cool freaking calisthenic pole dancing things. And then she also wants to get her endurance back for tennis. She's 37 years old. She was 145 pounds. She's 5'8". What we noticed during her overhead squat is that she had arms falling forward and an excessive anterior pelvic tilt, as well as shoulders elevating and another low back arch during the pushing and pull. So definitely an anterior pelvic tilt problem there. We tried to have her do the Rockport walk test, but her endurance was shot. So she couldn't get through the entire mile. So we know that we are looking for endurance assessment. So we're going to do the overhead and push pull for her posture, Rockport walk test if we can eventually work our way up to that, and the max push-up assessment, because that's a really good one for her upper body strength and endurance, and the dead hang assessment, which both of these are upper body endurance assessments. So we want to see how long she can hang from a pull-up bar without like losing her grip. So those are definitely things we are going to continue assessing as we work with her. Cardio wise, we want to get her up to 30 minutes on a treadmill 3 times per week if we can get it. And we want it to be able to be at 50 to 70% of her heart rate reserve, AKA zone 1. So when we're telling her how to do her cardio, we're going to encourage her to do a lot of stage 1 cardio. It's like, hey, you should be able to hold a conversation the whole time, but I want to get you 30 minutes uninterrupted, no breaks, right? Flexibility training, we're going to focus on the lats and the pecs, the upper traps, and then hugely those hip flexors and TFL, right? Those muscles that are creating that anterior tilt. Strength training wise, we're going to only start with 2 days per week to start so we can build up her endurance slowly. 1 to 3 sets, 10 to 15 repetitions. We are going to do a slow 4-2-1 tempo because that's going to help her with her endurance. We're going to focus on stabilization exercises because that's going to help with her endurance. And we're going to focus on calisthenics because, again, pole dancing is super body weight based. So the TRX suspension trainer is going to be huge, right? Those suspension trainers people use, and their body weight exercises. And we're focusing a lot on like lower body exercises in the frontal plane so she can get better at that side shuffling for things like tennis. So ice skaters, side shuffling, karaoke, things like that. We're going to avoid heavy lifting, and we're going to always have a chair available in case she needs to take a seat at any point during our sessions. Any questions on that one? Any questions on why we did what we did in the SOAP notes? Why we picked what exercises? Like, does that all make sense to you guys? How's everybody feeling? I should let you guys build a SOAP note. We should go back and build a SOAP note so that you guys have one for the next time I teach this class in 6 months. Jesse, do you have a question?
No, I thought I did.
Fair enough.
I was trying to engage.
I got you. I got you. You don't have to do it for my sake. I just want to make sure you guys are prepped. It must be. I'm aware that it's probably awkward on your end when it's like, "You have any questions?" It's like cricket, cricket. Don't sweat that. Okay, so class announcement. I'm going to put this in the email that I sent out here in just a little bit once I get this version of the upload started. Class announcement. We are going to meet on Monday. This is our last lecture. We have our final exam on Monday, so everybody will have homework. I'm going to put quizzes up online for this weekend, so you guys can do them all weekend and practice with the little meme game. Please get your homeworks 1, 2, and 3 turned into me by Monday, so that you're prepped and ready to go for the final as it goes out on Monday. And we're going to meet in that Van Nuys Park again, where we're going to do a little bit of cardio assessments, and we're going to do a little bit of performance assessments, which are super fun. It's like where everybody gets to do the Davies test. We can see who's the fastest Davies tester, who's the fastest shark skill tester. Kind of a fun one, right? So we'll do some of those performance assessments. And that way we will get through all of the assessments we've done in the book, and you guys will be familiar with them. So then we've done overhead, push, pull, and all the performance stuff, and cardio stuff. So that is going to happen on Monday. Look for my email here in just a little bit. But other than that, I'm going to let you guys go, and I will see you guys Monday, either morning or evening.
All right, I'll see you on Monday.
All right, see you guys.